Hi, everyone. Thank you so much for rejoining us. I hope everybody had a nice half an hour break, got up and stretched your legs. My name is Sarah Lunsford, and we're going to be doing
Recording in progress.
More participatory session this afternoon, really inviting all of you to engage in some content and share your thoughts and reflections. The session is going to be divided into two parts. We're going to start with some reflections on the workshop, really thinking about, the conversations that you heard or that you contributed to, and how you can incorporate some of the things that you learned, some of the things strategies that you heard into your daily work, and thinking really about the space that you occupy in public health emergency response and preparedness, and what you could incorporate into your daily work as part of an effort to rebuild and maintain trust in FEPR science. And then the second half of the activity is going to be looking sort of more bigger picture, more forward thinking about the field of FEPR science. What are the knowledge gaps? What are the action gaps? And what are the resource gaps that need to be filled over the next couple of years in order to more effectively rebuild and maintain that trust? We are going to be doing this activity in Miro. Hopefully some of you have had some experience with that. You should see just below the broadcast window on the event page, you should see a link to the Miro board. So you can click on that and join that space whenever you're ready. I see we've got a couple of folks in there already, which is fun. So I want to just, in case anybody is unfamiliar with this, or maybe just to remind people of how Miro works, it is an interactive space. If you click on it and go into the room, you'll start seeing the frames. And so you'll see the questions that are up there. Matt, if you want to go ahead actually and share the Miro screen so that people can take a look at it, that's great. So you can see the top half of the screen has the questions that we'll be using in part one, and then the bottom half is a timeline, and we'll be adding some thoughts to that in part two. You'll probably also see lots and lots of people's cursors running around, which may not be the most enjoyable for you as you try to engage in the material. If you go up to the top part of the screen, you'll see a blue triangle. Yep, Matt's highlighting it right there that says show collaborators cursors. If you click on that, it will hide everybody else's cursors. So Matt's just re-clicked it and I unclicked it so that you can not have all that visual clutter if that's not helpful for you. You'll still be able to see the content that people add to the board, but you won't necessarily see their names. In the bottom right-hand part of the screen shows the zoom in, zoom out percentage. So you can increase or decrease how zoomed in you are, and that won't affect how other people see the board. So you can feel free to move that as is useful for you. The other thing that I should say is, you'll see a whole bunch of sticky notes kind of all over the page. These are color coded by what kind of professional identity you have. So we have practitioners, people who work as practitioners have purple stickies. People who work as scientists or researchers are pink. The media is that light blue color. Local officials and administrators is sort of that teal green. The public, members of the public, are that brighter green, and then other people who may not sort of identify as anyone of those other types have sort of that yellowish orange color. So what you'll do when we kick off is you can just grab one of those stickies and drag it over to where you want to place your comment, and you can type right into it. And then when you're done typing into your sticky, please click outside of that sticky. When you're typing in it, it'll be sort of grayed out and hard for other folks to read. Once you're finished typing and you click outside of it, it will be clear and more readily readable for other people who are participating in this space. We do have a couple folks behind the scenes who are going to be reorganizing and resizing some of your stickies. So that's just in an effort to make sure that they are readable for everybody else. So please don't be alarmed if you see your comment moving around on the screen and you're not doing anything. That is by design. So with that, I am going to invite us to sort of zoom in on the top portion of our Miro board today, and invite you all to take a few moments to think about the questions that we have posted here. So based on what you heard or learned over the course of the workshop, what actions could you take to contribute to greater public trust in FEPR science? We've got some things moving around on the screen, so hopefully we'll get those cleaned up. If you could try to not move any of the content and just move the stickies, that would be great. I know sometimes Miro can be a bit finicky about things. So I invite you to grab a sticky that most aligns with your professional identity and drop your comments and your reflections into the box right underneath that question. The other question that we have posed is, what do you need to move these actions forward in your work? So that could be resources, that could be training, it could be really a host of things, but whatever you would need and in order to do your work more effectively. So I'm gonna be quiet and give everybody just a few minutes of quiet reflection to add in their thoughts. And just to note that we did grab some of Wade's amazing illustrations from yesterday's discussions and put them into this Miro board. So thanks so much to Wade for those wonderful contributions. I see some more folks have joined the Miro board, which is great. As just by way of sort of orienting you to the activity, we're focusing on the top half of the Miro board on the questions about what you heard or learned over the course of the workshop, and what actions you could take to in your daily work to contribute to greater trust in FEPR science? And then what do you need to do to move these actions forward in your work? So you can grab a sticky, just click on and drag a sticky that sort of most aligns with your professional identity over to underneath the questions and type right into it, and then click outside of the sticky when you're done so that everybody can read the content that you've put in. If you're still looking for where to get into the Miro board, if you go to the event page, you can you'll see the link just below the broadcast window. So that should hopefully you'll all find that. So I see some things being put into underneath sort of the first question of what actions people could take. Just a reminder, when you're finished typing, please click away from your sticky note so that other people can read them. But the content that I'm seeing so far is building relationships with communities and being more inclusive in the communities. Addressing concerns with empathy, admitting when you don't know something. Let's see, encouraging leadership to be more honest about where the science is. So a lot of stuff about sort of that humility and knowing what you know, saying what you know and saying what you don't know. And also, a lot about connecting with communities, recruiting and building those relationships with community members so that they can be advocates, utilizing the appropriate language and visuals that can help more concisely communicate messages. If you run out of stickies on the left-hand side, there's heaps on the right-hand side, so please grab what you need. There's also, if you need to add more stickies, it looks like Kelsey's just added a whole bunch onto the left side, so there should be enough for people to grab. In terms of what you need to move these action forwards in your work, strategic plans with communities and organizations that can promote more community engagement. More staff, always helpful to have more staff. If you are struggling with Miro for whatever reason, feel free to put any of your thoughts in the Q&A section on the event page, just underneath the broadcast player, and we can transfer it over onto the Miro board. Great. So I'd like to just take a moment here and invite some of our planning committee members to reflect on what has been shared in the Miro board. Sandra, do you have any reflections on what people are sharing?
I think, Sarah, that we're hearing very strongly the need to build relationships with communities and very diverse communities. And to do that, I mean, we heard yesterday, you can't do it at the time of the crisis. This is a long-term effort. So engaging people in strategic planning and making them part of your planning process, and engaging community members who can be your voice out in the community and help you think about how to do communication materials, et cetera, in ways that are culturally appropriate. That jumps out at me really clearly.
Great. Thank you, Sandra. Esther or Monica, any other reflections?
Yes. What I'm seeing through the stickies is this emphasis on human interaction or relationships. That's the soil in which trust grows. And I'm also seeing, and as Sandra was just saying, that's a longitudinal project. That's not a just-in-time project. A second theme that's coming across too is that community members want to be considered or should be considered as whole persons. They're not just decision makers focused on a protective behavior. They're also emotional creatures, social creatures who live in particular economic circumstances. So I see people sort of also pushing this issue of sort of treating audiences more holistically, or community members more holistically, showing them empathy while at the same time providing them scientifically sound guidance. So it's the whole person that public health needs to connect with in order to generate trust.
Yeah, and I guess I would, I'm also seeing maybe some sub messages or texts around mentoring science in communities, using data from other social sciences to inform our public health communications, thinking about encouraging leadership to participate in public health communications and what that's going to take. Concrete things like resources, which of course are necessary for all of these things. Realizing that communications is more than press releases and press conferences. Mm-hmm.
I saw admit when wrong. I thought that was really critical, and that idea came from the storytelling that was brought out. I think there's a critical need for a narrative, and that's before the post disaster, to prepare for for disaster and sharing of information. So I think that was a really good sticky there.
Mm-hmm.
Thanks, Kenny. That's great. We still have heaps more stickies being added in. And so I don't want to cut this short because I think it's important to sort of be reflecting on really what can you do tomorrow, or later today or next week, to sort of make some adjustments or changes or to integrate some of the concepts, ideas, and strategies that have been discussed over the last 2 days. So I want to give it another minute to allow people to finish typing their stickies before we move on to the next portion of the session. I think the other thing that is coming through is listening to all voices, and engaging with all voices, even if they don't represent the science that you represent, and that inclusivity, is important for building those relationships and for building that trust.
I think one other thing, Sarah, that seems to be clear here is really, this goes back to the session on infrastructure, but these themes have come up throughout. And that is not just more staff, but better training for staff and more capacity to address things like communication, social media, community engagement, in ways that health departments may often be challenged just because they don't have the adequate human resources to do that.
Something else that I think is coming up is this notion that this kind of work isn't limited or shouldn't be limited to crisis, that in fact, these kinds of community engagement efforts that we're talking about as critical need to be normalized and part of what public health does every day.
There's also transparency is something that is a lot of stickies are talking about being able to ask questions, being the community being able to ask questions, being able to for administrators, people within public health to be concise and communicate. If they don't know, they don't know. So I think that's something was really interesting for me.
Yeah, I think that goes back to what was discussed in the last session before the break about it being a conversation.
It is.
As opposed to sort of one-way external communication. That's great. All right. Well, I think, feel free as you are to continue adding more stickies into this portion. I'm just going to kind of run through the instructions one more time as we've had a few more people join the board. So if you've just joined us, we are going to move to the lower portion of the Miro board, which is really, you'll see this timeline here. And what the question that we have to pose to you is sort of think to the future. What are the knowledge, action, and resource gaps that need to be filled over the next 4 years? And 4 years, there's an element of sort of arbitrariness there for sure. So if you have something that's sort of longer projected out, please include that as well. To rebuild and maintain public trust in FEPR science. We have the stickies over on the left-hand side, same color coding system. So if you're a practitioner, grab purple ones. If you are a scientist or researcher, go with the pink. If you're a media, blue. If you're a local official or an administrator, that teal green. If you're a public, that sort of brighter lime green. And if you don't fit neatly into any of those categories, you can grab that sort of orangish, yellowish color, and click on the stickies, drag it over to where you think on this timeline, those gaps are that need to be filled, sort of how long it will take or what, maybe there's a sequencing of when things need to be done, to fill those gaps. And type inside your sticky. When you're done, please click out of it so that other people can read your content. And as before, We've got some folks on the back end who will be adjusting sizing and moving them around a little bit, all within sort of those timelines, but don't be surprised if your sticky does move. And I want to just sort of remind us something that was said yesterday and that came through quite clearly towards the end of yesterday's conversations of being in this moment where we can either continue on with having public health be transactional or have it be transformative. And sort of this, perhaps a fork in the road, maybe a bit of a strong metaphor, but I would hope for you to sort of keep that in mind of as we try to move towards a transformative approach that can really change the future in a lasting way, in a sustained way. What are those needs that or those gaps that need to be filled? If you could, we've sort of separated out with sort of knowledge gaps on top of the timeline and actions or resource gaps on the bottom of the timeline. So thinking about that as well as when you place your stickies. So I'll give you just a few moments. And if you are struggling or aren't able to engage with the Miro board, please do put your comments in the Q&A portion on the Slido right underneath the broadcast window on the main event page, and we will bring those over. So I'm seeing several stickies pertaining to training of different types of people, training with officials, training staff and volunteers, training with community, exercises and practice with these different stakeholders. Certifications in public health communications to sort of upskill or reskill the workforce. And then related to that, sort of a transfer of knowledge between staff, old and new, people who have more experience with people who are newer in this field. And it's interesting because you've placed all of these issues of training sort of across the entire timeline, which I think is an important point to note, that it is not a one and done. Training, standalone types of trainings, have limited effectiveness in terms of actually impacting how people do their work, and that it's a continuous, ongoing effort to train and build the skills of people across these different groups, that are necessary for effective communication, for effective response, and all of which sort of undergird building a relationship of trust. I see a large sticky on funding. So to go to the session that Monica facilitated yesterday about really, making sure that we have that infrastructure.
And Sarah, if I could just point out too, is the sticky where more experts needed in written, visual, and oral communication. And I think we heard several times the importance of bringing in or getting beyond the usual suspects. And we've got to pull in our artists, our singers, our poets to be part of this community as well.
I think the other thing, building on what Monica just said, that is clear in all of these, but it's been clear in the workshop sessions, and that is that we really are talking about communication. We're not talking about messaging. And too frequently, the word that is used is messaging, which to me implies that it's one way. And what we're seeing here, and we've heard throughout, is, that communication merges out. It builds relationships. It helps us address the needs in the context of specific communities, and that we do a much better job at doing it when we do it with our communities and our partners. So it really is a two-way ongoing exercise. It is not a message. And I think we're seeing that throughout all of this as well.
Thanks, Sandra. Another sticky that's been put up in the 2022 spot on our timeline is to set clear expectations and understanding of what happened, what went right, and what went wrong, so we don't repeat our mistakes. And I'm wondering, Sandra, Monica, Esther, Kenny, if you could sort of reflect on that sort of approach to learning from previous events and how that sort of needs to be built in. I don't want to call it a postmortem or an after action review, but that type of scenario, and where that should fall, especially when we're talking about a protracted emergency like COVID.
I think there's a provision in the current draft of the bipartisan Prevent Pandemics Act to have a communication and information task force. And I just want to pull in one of the speakers' comment about the need to really dig in to a thorough review of the COVID-19 response. I know we're talking about FEPR science. It's bigger than the COVID experience, but if we do that well, we can develop processes for constructive criticism and also celebration of successes with regard to COVID-19. And also to underscore Sandra's point, communication, we think more in terms of commune, to come together. It's about connection and less about transmission of information and data points. I think we kind of have, in a technologized culture, sort of put distilled relationships down to exchange of data points, when it really is about communing and really resonating with each other, even if we come from different perspectives. So I think just to underscore that the countries need to, as a whole, and for local communities too, to reflect on how things have been unfolding in the current response, because sadly we're going to have many more emergencies of different kinds, and we have to get our systems right. So I just want to pull out some of those themes.
I think it's also, I saw a sticky on it right here. It says willing to share strategies. I think during this period of time, I think the strategies that all levels of government have used to not solve, but to address the concerns of COVID can be generalized, and those strategies should be in forums like this shared with other frontline managers, administrators, professionals who are dealing with it. Community workers, community leaders should be involved in sharing these strategies, because it's a great thing to have a great strategy for one place, but maybe it can help another place that's experiencing the same problems. So I think that's like a key to it.
Another theme I'm seeing in terms of lesson learned is this need to conceptualize the work of public health preparedness and perhaps public health communication in the context of emergencies, requiring partnerships with behavioral scientists, historians. Someone posted something about the business community and bringing in business disciplines. I mean, I think it's recognizing that this is much bigger than how we've traditionally maybe narrowly defined public health. And I think what we've learned is that, as some of our speakers said earlier, you can have a great vaccine. If no one takes it, it's not going to do what you need it to do. And I think we recognize that one of the biggest things we've learned is that we don't know what we don't know when it comes to human behavior. I'm also interested in this concept of broadening surveillance to capture communication strategies, use, and their outcome. And I think that this this theme of sort of the type of data we need to be collecting and monitoring during an emergency is so much more than case counts and vaccine receipts. It's human behavior things. It's qualitative and quantitative information around what the public's perceptions are at different times in the pandemic, so it can inform outreach strategies. Monitoring social media, which every JIC should have the ability to do, but a lot of places don't have the resources to do, to offset, to quickly identify rumors. I mean, some of this stuff I think needs to be institutionalized. The fear is that once things start to get a little bit better, the funding goes away. That's the story of public health. And, we have lots of lessons learned in public health. And one of the worst ones, I think, is how the minute we get good at something or the problem starts to diminish, the resources disappear. And I think one of our biggest challenges is going to be to convince the folks that fund this work, particularly at government levels, what needs to be sustained and how it needs to be sustained. I was struck in this workshop that so many of our presenters are from the state of Washington. What do they know in Washington that other states don't know in terms of the funding of public health and its activities at the state and local level?
Thanks, Esther. That's a really great point about the funding, and I know, I want to ask you all something. So if we take a look at this mirror board, and I'm not sure if it's real or not, but there's a big clumping of sticky notes sort of in the 2023, 2024, looking out in the next 2 years. And again, not sure if that's just because that's where people place them. But I think what it does speak to is, and what you've all just commented on, is that there's a lot to do. There is so much work to be done to really build our knowledge, to build our practice, and to advocate for sufficient resourcing. And so how do we prioritize, recognizing that we can't do it all at once? How do people who occupy these different spaces, from the practitioners to the officials to the media, to the researchers, what kind of prioritization effort needs to be undertaken in order to figure out where do we allocate our time first?
And we could allocate our time by developing collaborations. I think that's a great place to start, having forums like this workshop where we have professionals, scientists, all coming together, people within the media. I think this is a great, forums like this where we can start by collaborations and learning from each other is a great start. And then we can proceed on to everybody working together to establish certain things like sustainable investments, communications, so I think these kind of things, and training is also a great place to start.
And I think too, Sarah, just based on what I'm seeing here, is that the type of changes that people want are going to require parallel processing. So while practitioners can immediately make sure to monitor and strengthen their relationships with a variety of community partners, particularly those who have roots in underserved communities, there's that urgent work that needs to be done from a practitioner perspective. From a policymaker perspective, these structural changes in terms of sustained, adequate budgets of a longitudinal kind. There's that's another level. And then we've heard a request throughout the 2 days and then now on the Miro board for more social and behavioral understanding. And I think, so it's a challenge to the social and psychological scientists out there to be part of filling our gaps in knowledge. Both just in time and over the long haul. So I think there's parallel processing with policymakers, practitioners, and then scholars, and then the community too, because it's the community's voices that matter, and also their tax dollars that are at work here. And I think holding people in positions of authority accountable for how their tax dollars are used, and how the public's health is protected, is a role for the public.
Thanks, Monica. So Marion Jones, who was on one of our panels yesterday, just sent something in the chat. Marion, I'm wondering if you could come off mute and talk a little bit more about delaying the inevitable return to normalcy.
Sure. Thank you. Yeah, I just was struck by the fact that we're all driven to accumulate the actions in 2022 and 23. I know, looking at the 1918 to 20 flu, that there was this return to normalcy in the 1920s, and then institutional forgetting of the lessons of the pandemic. So how can we build institutions that and long-term initiatives that that prevent that forestall that, right? So it was more maybe a suggestion. So when we're thinking about proposing whatever it is, whether it's a new communication strategy or a new, community engaged program, that it be something that we say is going to last for the next 10 years, or something we hope will be a long-term project and not just a backward-looking project toward the pandemic. Thanks.
Thanks, Marion. Any reflections on that institutionalization component, Esther or Kenny?
We've heard so much about the need for effective community engagement, and just maybe this is an extension of what folks have said. And what I'm seeing on the Miro is, we need to thinking about ways to break down the walls of the health department. I mean, this pandemic has given many departments reason to be in communities and show up and be present. And the key, I think, is to sustain those relationships and to sustain that presence. So that the health department is effective in the day-to-day emergencies of, obesity and diabetes and cardiovascular disease and violence in many communities, but also when there's another pandemic or flood or weather-related disaster. And I think the challenge is going to be, when the resources start to dry up, how do you still sustain those community relationships when maybe you don't have as much to offer? Maybe you figure out ways to interact with community organizations so that even with less resources, the public health department is more responsive to the needs of communities and you maintain those relationships. I think that's what's really key for an ongoing plan. It helps with communication, it helps drive priorities, it helps with understanding where the public is and knowing where the public is so you can meet them where they are when you need to.
I like to put a plug in for teaching public these kind of issues in public health and public administration and curricula. That's a couple of stickies there showcase a need for us. So in order for us not to go back into normalcy, we need to educate the future professionals to tell them, like, this is COVID occurred, but it's going to be a part of your jobs on a regular basis, and that you have to deal with it. So I think education is a start, in making changes to the normalcy.
Great, thank you. I think, when we sort of, I think that there's such a big advocacy component in here that seems to be coming through, of advocating to those decision makers at a local level, at a national level, to make these adjustments within their systems, and thinking not just about, systems of government, but systems of education, continuing professional education, both, high school and college education, and maybe even before high school, maybe elementary school, as we start to think about these things, but also continuing professional education for, social workers, public health professionals, doctors, nurses, lots of people, firefighters, lots of people who are working in these spaces in very different ways. How do you do that type of advocacy when you don't have a line item in your budget to support it? And I come from a healthcare quality improvement background, which is much more of how can we just deliver better not thinking, and when the answer isn't just get more funding or get more staff. And so how can we, as much as we would all love more funding and more staff, that's not always a reality. And so how can we do all of this within the confines of the resources that are currently available?
I'm going to sort of play devil's advocate. We are at a moment where there are substantial federal resources, and we are talking as a country about how to modernize the public health infrastructure. And sometimes the answer is in fact more resources, but the resources have to be applied in a strategic way, and that's where we need more thought given. So, and others on this call can chime in here, but I think the resource question, given the substantial funds that are out there now, is an important one. A colleague who's a former local government official said that health equity is no longer an unfunded mandate if we take a hold of these resources. So anyway, sorry, Sarah, to sort of be a fly in the ointment.
No, not at all.
Yeah. Okay.
I mean, especially, I don't know that we could expect that while there has been a great investment in resources over the last 2 years, as has been mentioned, we'll get it. I think, Esther, you said it earlier, we'll get it right. And some of those resources will disappear. And so I think it's two things. How can we leverage the existing resources for that sustained change? But then how can we also carry it on when those resources are no longer readily available?
And I would submit that. So go ahead, Kenny. I'm sorry.
No, you can go ahead because I have just one small comment. You can go ahead.
I was just going to add that I think this is a leadership issue. I think that the leaders of public health departments need to understand that this is part of their job. I was struck by the presenter who's this morning, I think it was Dr. Stippling, who talked about running public health preparedness for Planned Parenthood, which is an organization that's has spent a lot of the last decade in crisis and understands full well the need for supporters and advocates. And public health is in that same space right now. And I think, most leaders of public health, of government public health agencies are appointed by elected officials, and they don't always get it right. You can't just pluck someone who's practicing medicine for 30 years and put them in the health commissioner spot. You need to have someone who really understands the role of the public health department in a political environment and what the responsibility is to a population or a community as opposed to, say, groups of individual patients. And that's a different perspective. And I think a lot of the strategic decisions that are made around where resources get spent and how to do things like communications and advocacy come from the top. And you need leaders in public health agencies and also elected officials who understand that and strategically make decisions around how to create advocates and do advocacy.
I just wanted to add that what about bottom up? Looking, I think somebody in yesterday's discussed the idea of informal community leaders taking the role and administrators allowing them to take that role. So if you're in a community, relying on the community, leaders, organizations to educate them and have that educate, because they're going to stay in their community. So if again, every 4 years, every 2 years, somebody changes, there needs to have that person that has the storyteller. I'm using the thing. So maybe we need community leaders that are part of the strategy to then educate the rest of the community and be that kind of, that memory holder on things that should be, how it's informing the community.
Great. Thank you all. Any final comments from Monica, Kenny, Esther, before we close out this portion of our agenda?
I guess apart from financial capital is the human capital. So going back to Kenny's point about education, our public health workforce, currently its composition does not match the demographics of the United States, particularly when you get the difference between low, mid, and high managerial levels. And so the more that the public health workforce represents, looks like, speaks in same languages as the populations that they're serving, that is a formula for greater, the conditions for greater trust to take root. So the human capital piece is also very important.
I'm seeing some comments about partnerships between the medical community, primary care, and public health. And there's some examples of the Netherlands where I think that's where that, is definitely true. And I think, we do ourselves a disservice in public health by assuming the medical community is in its own silo. And there's a lot we can do collectively. And I think we heard some good examples in the last 2 days of public health agencies that have really leveraged those partnerships.
Great. Well, thank you to Monica, Kenny, Esther, Marian for jumping in prompted, and Sandra for your reflections. And thanks to all. There were, I think, at one point about 55 people in the Miro board. So thanks to all of you for your contributions and your thoughts and reflections on the workshop.